30, 40 years ago, we conceived of atherosclerosis, which is a major scourge of mankind, as a cholesterol storage disease. And what we've come to appreciate in the last decades is that inflammation is a very important process that drives atherosclerosis and its complications. Not just the initiation, but the progression of the disease and even its thrombotic complications. Now, inflammation is not in itself the risk factor. Inflammation is a series of pathways which connect the traditional risk factors such as low-density lipoprotein, LDL, hypertension, smoking, etc., to altered behavior of the cells of the artery wall to beckon white blood cells to enter the artery wall from the bloodstream to give rise to the disease and its complications. What we've learned in the last few decades is that if we modulate inflammation, we can improve cardiovascular outcomes. One of the major victories in this regard is the statins, which certainly lower low-density lipoprotein, but also appear to have an anti-inflammatory effect that's independent of LDL lowering, as gauged by a reduction in a biomarker of inflammation, high-sensitivity C-reactive protein, or C-reactive protein measured with a high-sensitivity assay. And we found that the statins lower LDL and lower inflammation, and that part of their benefit probably derives from the quelling of inflammation. But of course, even patients who are very, very well treated with statins, even patients who have had, in addition, ezetimibe or an anti-PCSK9 antibody or other therapy, will have residual risk. We know that events are still occurring even when we can drive the LDL down to 0.77 millimolar, as was done in the Fourier study, and similarly in the Odyssey study with evolocumab and alirocumab, respectively. So just targeting LDL is not enough. Moreover, we've learned that the anti-PCSK9 antibodies, although they very handily drive down the LDL, do not affect inflammation per se, as gauged by the HSCRP test. So that leaves us with a residual burden of risk that we need to address.